Welcome to The Bee's Knees, a podcast full of articles, interviews, clinical studies, and advice about knee surgery, physical therapy, and life after knee surgery.
Hi, welcome to the Bee's Knees podcast. This is your host, PJ Ewing. We have quite an episode for you today. I really don't want to ruin it, so I'll just give you the headlines, which almost reads like a movie trailer or a thriller or an epic saga, because yes, we're talking about knees and knee replacement, but in this case, we've got extreme pain, a failed recovery, a renewed approach, fortuitous neighbors, chance meetings, and an extremely good recovery in the end after tremendous challenges. Pain is the topic of the episode, and how to overcome that pain with circumstances that are really beyond what I hope anybody has to go through. So without trying not to ruin it for anybody, let's get into the interview. It's Mary Elliott and Tom, the subject of the story, and they're in conversation right as we start. So let's listen.
Well, hi there. This is Mary Elliott from X10. The reason why I am speaking today is I've got a wonderful, wonderful human being. His name is Tom, who went through knee replacement surgery recently and is still, he started off having some pretty major complications. And unfortunately, he has just encountered another complication through his recovery. So our intention together here today is to help guide you, to give you some paths to take, some wisdom, some things of what you should do moving forward as you contemplate having knee surgery and do so, and some things where, I shouldn't maybe go and take that path because, that's not the highest path for me to get the desired results I want to get, right? So I'm going to welcome Tom. Hi, Tom. Do you want to introduce yourself and tell us a little bit about you?
Hi, Mary. Sure. I'm 59 years old, and I've been an athlete my entire life. I played pretty much every sport that you could play as a kid, and I ended up being a scholarship football player out of high school, and played a couple years in college, and continued to be active my whole life. I took up skiing later in life, and loved that, and I used to run, work out 6 days a week in the gym, lift. So I've been very active my whole life. I coached basketball. I have two daughters, and I was their basketball coach for most of their young adult life. And during one ski session, I tweaked my right knee, probably about 20 years ago. Not too bad. And in 2003, during a basketball practice, I was being a defensive mannequin, and I turned the wrong way, and I tore the cartilage in my right knee. And that caused arthroscopic surgery where they took out 30% of the cartilage. And so for the past 16 years, my knee has slowly deteriorated until I was bone on bone. And that basically I went in, and the doctor said, your only choice is to have knee replacement surgery.
All right, so now you're going to have knee surgery. You make the decision, the doctor tells you you need it. What were you anticipating knee surgery and recovery was going to look like for you?
Well, I had thought that I had gone through that experience with the scope, and I honestly thought that my recovery was going to be very similar to the recovery that I had being scoped. And that was about 5 weeks of therapy, which started 7 days after the procedure. And I was up almost 100% at the end of that period of time, and it was very easy. My mom also had knee replacement surgery about a year and a half ago, and she went through it in a breeze, and she had no complications, and she didn't suffer any discomfort, and her therapy went like clockwork as well. So because of those two personal experiences, I was expected, because I was active, to sail through therapy, and I didn't think it was going to be a big deal at all.
Okay, and on my end, to be honest with you, what we see is the younger patients struggle more through recovery and have a lot more complications as far as moving forward than our older patients. And one of the beliefs is, younger patients do form scar tissue faster, right? Because your bodies are healthier, right? They're active. Mm-hmm. All right. So, all right. So that being said, all right. So then what happens? You go in and have knee surgery, and then what happens after that?
I thought that I was told the doctor said everything went great. I had a surgery on the 28th, of Friday, and after surgery, I was fine that day. I felt good. They put a blocker in my knee. I didn't even think I needed the pain medication that night because my knee felt fine, and the swelling wasn't that bad. And I was all set to be released from the hospital the following day on Saturday, and they were preparing the discharge papers. And Saturday morning at about 10:30, a physical therapist came in and said, we have to do some certain standard tests to see that we can discharge you. You have to be able to go to the bathroom, and you have to be able to get in and out of a car. And they said, just come on down. Well, I was in a room with another patient who had knee replacement surgery who was in his 80s. And the physical therapist just literally had him stay in bed in the room and had him sit in a chair and did a very minimal amount of therapy in the room. And then my therapist said, okay, let's get out of bed. And he had me walk from my room down to the physical therapy room in the hospital, which was about 150 feet. And when I was there, he had me basically get on a table. He bent my knee to 90 degrees. He had me do leg lifts. He had me do leg extensions. He had me getting up and out of a car. They had like a fake car there. He had me walking up and down stairs, and it lasted a good 20 to 25 minutes. And then he asked me to walk back to my room. So between the time I started to the time I was finished, it was about 35 to 40 minutes of a physical therapy session. So that was about 11:30, and I had called my wife telling her to come pick me up. And within 45 minutes of having the physical therapy session, my knee ballooned 3 times the swelling. My whole leg, my ankle, my foot, my calf, it completely swelled up, and the pain level went to about a 7 and would not subside. And the doctor and the physician's assistant came into my room and said, wait a minute, you can't be released. And so for the next 48 hours, I was basically at a 7-level pain, could not bend my knee at all, and I was not released from the hospital until the following Monday. And when I was released, it wasn't that much better. I was supposed to start physical therapy out, in a patient at home. The therapist came to the house that first day. The nurse came to the house that first day. They looked at my leg, and they said, oh my gosh, Tom, we've never seen swelling in the leg quite this bad before. I've never had a patient. My X10 coach came out to the house to take a look, and he said the same thing. He said, I've never seen swelling quite that bad on a knee before either. And for 12 days, I could do nothing. I couldn't put any pressure on my leg. I couldn't walk to the bathroom. I was using a walker and basically lifting my leg up off the floor, because any time I put my leg down when it wasn't elevated, it throbbed and it hurt. And the pain was 24/7.
Let me ask you something. All right, so you just described the physical effects, right, of what just happened to you. But, I just got done reading a book that a surgeon wrote about knee replacement surgery. And right in the beginning, I would say in the first few pages of this book, and I realize this because I had a disease, so I understand where he's coming from. To heal, it's not just the physical part that we need to address, right, but also the mental, what was going on now, because here you just shared with me earlier that, wow, my mom went through it. It was a breeze, right? She had no problems. I had an experience with my previous surgery on my knee, sailed through that. What's happening to you internally? Tell me where you were at.
That was a very dark place.
Yeah.
I had been prescribed Oxy, the painkiller, and I was told that one of the effects of that was depression. And I don't think there was any doubt that I went into a depression. My whole outlook changed, and I basically quit. I didn't think I was going to be able to walk again. I questioned myself. I didn't understand why I couldn't move my leg. I thought it was a weakness that I had. And it was, I didn't want to move my leg because of the pain. And I thought I was condemned to having a leg that I couldn't use the rest of my life. And the people around me, my wife, my mom, basically said they had never seen me like that before. That I'm a positive person usually. I'm a person to say, well, let's get this done. Let's do what we've got to do to resolve it. And that was not me at all. At all.
Okay, so all right. And I'm so glad you shared that, because a lot of people, when they get into that mode, right, are really hard on themselves too, right? Because that's where you're at, like, oh my gosh, I'm losing faith in that my life's going to be the way I thought it was going to be, right? And I'm scared, and oh God, how do I deal with this, right? Because that's never happened to me before, right? It's all new paths you're walking there. All right, and I am a true believer that when something happens to you, right, first of all, I feel things don't happen to us, they happen for us, because there's always a hidden blessing, even in the darkest of situations. So can you tell us then, what happens at this point? How do you turn this around? How did you turn it around?
Well, there was three things happened. On July 9th, Dr. Green called my wife and basically said, how's it going? And she told him what condition I was in and how I had not moved the leg. And he basically said, you have to move the leg. If you want to regain use of your leg, you have to use it. And he told me that I had to get up on a hard surface, and she had to push my leg and bend it 8 times a day. And I just didn't see that happening. At the same time that happened, the day after that, on the 10th, John and Aaron from X10 came out, because they had been calling me throughout the 10-day period that I was suffering, and just asking John would call me every day, asking me how it's going. And so when Aaron came out, Aaron got me and said, have you been able to use the X10 machine? And I hadn't been able to get on it. I tried one time to sit in it, and just putting my foot on the foot pad of the machine caused a pain that I simply had to get out of the chair. I couldn't even sit in the chair.
Wow.
And the third thing is, my daughter is a fourth-year medical student at Michigan State, and she came out and she looked at my leg and she started doing some muscle manipulation in the leg. And she tried to encourage me, and she said, Dad, she said, you have to move the leg. The surgery was successful, and yes, you overdid it, but you've got to start getting movement in the leg. And she said, you're not going to hurt your leg by moving it. You've got to do it. And then Aaron got me in the machine on the 10th of July, and for 5 minutes, we set the flexion at 47, and she just had me get on the machine for 5 minutes. And she said, I want you to talk to me about your favorite vacation. And so I experienced a great deal of pain for those 5 minutes. But Aaron talked me through it. Jeannie was there talking me through it, laughing, trying to get my mind off of it. And I got through it. And when I got off of the machine, the pain went away a little bit, and it felt a little bit better. And then Kelsey came out the following day and stayed with me and helped show how to bend my leg a little bit. And I started bending it. And I made the commitment to myself that I'm going to do this. And every day thereafter, 3 times a day, I would go 1 minute longer on the X10 machine, and I would do 1 degree more flexion on the X10 machine. And so after about a week, I had gained 20 degrees, and I was up into the 60s. And then I spoke with John on the phone, and he said, Tom, he said, you know, you're still kind of behind. Why don't you try going 2 degrees more a workout to see if you can get there? And I was doubtful because every workout that I did, every single degree was just as hard to get as the previous degree. So going from 47 to 48 and going from 78 to 79 was just as hard for me. And it hurt just as much. And so the mental strain of day in, day out, every day, 24 hours a day, trying to get it better is not an easy thing to get through. But everybody around me helped, and everybody encouraged me, and everybody kept saying, keep going. And I got off the oxy, and that helped a great deal. I didn't have to take that anymore, and I became more myself. And then the momentum started happening, and the 2 degrees per session started working. And I realized that after I did my workouts, after I did the X10 machine, I was able to recover, and my knee was getting better. And so I progressed till I did 105 on the X10 machine in August, and I caught up ground. So after 12 days of doing absolutely nothing, within 5 weeks of surgery, I had gotten to 105. And it was just simply all of the encouragement that I had gotten from everybody around me, and also my daughter, because I trusted her that she knew what she was doing, and she had a way of doing muscle manipulation in the back of my leg as I was bending my knee that allowed my muscle to relax a little bit in a way that no other therapist helped me with. Kelsey really, really gave me the confidence that I could bend my knee. And so for 2 months, the entire month of July and half of August, it's a challenge. It still is a challenge. It hasn't eased up.
Wow. Okay. All right. So how many sessions were you doing on the X10, Tom? Were you doing 3 a day then?
I was doing 3 a day. This was before I started work. So the entire month of July and the first week of August, I was off of work. So the in-home therapist had me doing a series of exercises that I would do 3 times a day, and I was alternating between a stretching therapy workout and an X10 workout. So I was working out 6 times a week. And I had built myself up to I was doing 40 minutes on the X10. The first 10 minutes were warming up where there was no pressure. I just got the knee moving. And then the last 30 minutes of the X10 machine, I got to a level where every 2 minutes I would go 1 degree. I would set the machine 1 degree. So there was a range of 15 degrees every session. So if I went from 100, or if I went from 95 to 110, I started at 95, and 2 minutes later I'd move up to 96. And then the next session I would start at 96 and move up. And that's how I did it.
Okay. And did you see yourself shifting finally then? Because it sounds like you were shifting, more pieces coming in, more belief, more strength as far as inside and outside of you, right? Not just your body strengthening, but your state of mind, right? Because you could see that, oh my gosh, right? I'm climbing out of this hole. I'm walking into progress, right? Is that how you were? I'm sensing that, right? Okay,
when I got to the 90, that in that 90 to 95 range of the flexion. I started being able to put on my own shoes. I was able to get off the walker and start with the cane. And then I got to 100 and I started to go back to work. And in that range, in that week's time, that's where the mental outlook changed.
Yeah, that's what people aren't prepared for, right? And you just hit it, right to the core of it. When you become ill, right, and your freedom gets taken away and your independence gets taken away from you, and putting on a pair of shoes is even possible by yourself, that plays a toll on you mentally that, right, I don't think there's strong enough words in our language to describe. Don't you agree, Tom? I mean, oh my God, once that's taken away from you and you can no longer do simple things to take care of yourself, it is quite unnerving, frightening, and once you can finally get that back, boy, does it shift and make you feel like yourself again, right? And you start regaining your sense of self and power again, and that's incredibly rewarding. Just a simple thing of being able to put your shoes on, right?
Yes, I did not expect, nor my wife expected, what was going to happen and how incapacitated, and I felt like a burden. I felt I couldn't do anything. I couldn't even go to the bathroom myself. I could not reach down to bring my shorts up after going to the bathroom. It's very humbling, very humiliating, and I didn't want to be a burden to anybody.
Yeah. So, okay. So, yeah, that's right. That's it in the raw, of course. I've experienced that myself in my own life, and I was a caregiver, so I so can relate to where you're coming from. All right, so now, okay, things are starting to turn around, and you're getting your independence again. So at what point at some point did you feel, okay, I got this, right? This is now on the mend. I'm moving forward. I got my life back. I'm going to now realize my dream of having a healthy knee again. Did that? Yeah. Okay. So describe that a little bit. So what finally triggered that? Was it all just in little increments that got you there, or was there a moment besides putting on the shoes that really threw you into that great space?
Well, Dr. Green had told me that he believed that I would regain 130 degrees flexion. And that would be, I may be an outlier and get a little bit more, but he thought I should be able to get back to 130. And last Monday, when I was in physical therapy, I reached 120. And I was only 10 degrees away. And it was like, I'm almost there. I'm back to where I couldn't do 40 degrees. And in a month's time, 5 weeks' time, I did 120. And I left physical therapy that day saying, I'm going to make it. And I can't wait. I'm going to get normal really soon again. This is coming back faster. And only to wake up the next morning and realize that wasn't the case. So,
what happened? What happened the next morning?
I started having the pain back again. I had sharp pain in 3 areas of my knee. On the outside front right of my knee, on the back of my knee on the right side, and on the left side. And what ended up happening when I went back into physical therapy on Tuesday, they said that my muscles have spasmed. I irritated the tissues underneath the kneecap where all the muscles attached, and that the muscle had pulled the patella medially to the left, and it was displaced, and it was causing all of that discomfort, and they could not bend me. My flexion decreased to a 105. So for the past 4 or 5 days, I called the doctor's office, and they told me to do muscle massage and try to get the muscle loosened up, use a heating pad and a cold pack and ice, elevate the knee, and go back to therapy on Monday and see how your knee is feeling. And so I'm kind of in a holding pattern right now. I'm a little more philosophical about it. I still have made great progress, and maybe this is just a temporary blip in the road, and everybody says it's going to come back. Don't worry, this happens. And so I'm taking it that way. I'm taking it as a temporary blip, and things will get back on track.
Okay. Well, I've got to say, right, based on everything you just shared with me, you're in a pretty strong, powerful place, Tom, right? You've gone through some pretty dark times throughout this recovery, and look at you, even now with another obstacle in front of you, you're still staying strong, right? And that's what I'm talking about. Even in the darkest of situations, you can find a beautiful gift within it. And look, it has. It's shown you, hey, I can overcome an obstacle, and even this obstacle I can overcome. And knowing, and isn't it empowering to know, hey, my leg was able to bend to 120. So even though, right, I just experienced a little setback here, I can overcome this because I know my leg can bend to 120, right?
Yes, I know I can do it, and I will do it again very shortly.
Okay. Well, let's talk a little bit about how'd you choose your surgeon? Why did you choose Dr. Green? Because I know he's a wonderful surgeon, but what made you say, yep, I want him to do my knee replacement?
A couple people that I know had surgery with Dr. Green, and one gentleman friend of mine actually had both knees and a hip replaced by Dr. Green and spoke extremely highly of him. And another unrelated person that I knew had a connection with through work used to work in a doctor's office that worked with Dr. Green, and she recommended Dr. Green to me as well. And then I tried calling him and was told that he's not taking appointments for 6 months, and that I couldn't even call. I couldn't even go and see him for an appointment. I'm thinking, well, if somebody's that busy, he must be good. So I was willing to wait. And I made the phone call, and I got in to see him in January of 2019. So I originally made the call in May of 18 and finally got an office visit in January of 19. And then we rescheduled. We originally scheduled the surgery for May 3rd, but I got married. And I didn't want to be walking down the aisle with a
walker. Congratulations. That's beautiful, Tom. Oh, wow. That's beautiful. Wow. That's beautiful.
I delayed the surgery.
Well, I can see why. Oh, that's fantastic. That's beautiful. All right. Well, okay. So you knew, you were very confident in your surgeon. What about, did you give any thought about your recovery? What tools you were going to recover with, how you were going to recover? Any thought placed in that, or tell me how that went in your mind and in your decision making?
Actually, my partner is next door neighbors with Paul Ewing, and we had previously, a year and a half ago, done some accounting work for the X10 company, and I had gotten to know Paul. And I knew about the X10 machine, and I knew what it could do. And it was sort of like, in my mind, I was going to use the X10 machine. And when I went in and talked to Dr. Green in January, he's not somebody who uses the X10, but I asked him if I could. And he said, no problem. He said, I have no problem authorizing that. And he said, I totally understand. You have a familiarity with it, and go ahead. So I had put thought to it, and I was planning on using the X10 all along.
Okay, and all right. So, all right. Now you told us how your recovery went. Can you explain to me what role you think it played, if having the X10 versus if you would not have had the X10? How valuable was it for your recovery?
Oh, I think in my mind, the X10 was the one constant that I knew that was safe. It was a safety net. I could get on that machine, and I know the machine would go and move my knee to the degree that was on the screen. It wasn't going to do it any more or any less. It wasn't going to apply more pressure or less pressure. And every day before I started the machine, I was thinking to myself, how in the world am I going to bend it 1 degree more today than I did yesterday? Because it hurt to get to where I was. And the process of being on the machine for 40 minutes, it was like that machine just gently moved my leg over that 40 minutes every day. And it would loosen up over that 40 minutes every session, 3 times a day. And eventually I'd get there. And I'd get to that last 2 minutes where I would go 1 degree farther than I did the previous workout. I can't explain how the machine did it, but it worked. And I got 1 degree farther. And over a period of time, that confidence that the machine was not going to hurt my leg and that I could do it was invaluable. So there was a great deal of comfort and of security, knowing that I was getting better. The machine was taking care of my leg and my knee, and I was improving.
Yeah, huge on both levels, right? Not just physically, right? The physical improvement that it was causing, but also the mental stability and hope and faith that it was producing within you too. Right? Yeah.
I think it's 90% mental, Mary. I really do.
Me too. I do too. I'm like that too. Yes. And until you, everyone out there, if you've never been ill and have had your physical freedom taken away from you, really those words probably don't mean as much to you right now. But if you have ever or will ever have a situation where your physical freedom has been limited severely, oh my goodness, does it play havoc on your imagination and your mind. And it's so easy to go into fear. And when you're in fear, it almost paralyzes you. It does paralyze you. And it takes some incredible amount of courage and strength to bring yourself out of it. And anything that can help you move from that dark place into a solid place where you feel, you regain your faith and hope that things are going to get better and I am going to achieve my goal and I'm going to get my health back. Anything that you can give yourself during those times is incredibly important and valuable to you. Yeah.
It was incredibly emotional. There was also one thing, too, that happened, an event. You guys post on and you send out emails of stories and of people's life story. And at one point when I was at about 78 or 79 degrees, you guys emailed a story of a woman down in Miami who was a dancer. And she had knee replacement surgery, but she didn't have the X10 machine until 6 weeks after her surgery. And she explained the fear and the pain and all of the things mentally that she went through. And it hit me really hard. And it was very emotional. And it gave me the courage, too. That was another big thing. Reading that person's story, that she went through it. And she was at the same dark point where I was. But she got through it. That helped a great deal.
Yeah. And honestly, Tom, what motivated you to talk to me today? Right? What was your motivation?
If whatever I say helps another person get through what I got through, it's worth it.
Yeah. Yeah, right. Paying it forward, right? That's what we're doing. Yep. Paying it forward. Anything that you want to add that I may have not asked you, because, this is your space right now, Tom, to say whatever you need or want to say to someone, who's contemplating or having or about to have knee surgery, or someone who's currently going there, through their recovery.
Just hopefully you're blessed with people around you who will support you, because you need to lean on them. And they'll be there for you, and you can't do it by yourself. You need other people to help you, so rely on them.
And that was beautiful. Now, if that was one lesson I learned while I was sick. I'm very independent, and you sound very independent too, Tom. And I thought it was a sign of weakness to have to lean on someone. And then I actually learned it was quite the opposite. When you allow yourself to be vulnerable and lean and ask for help, that's actually a sign of courage and strength, right? That you're able to recognize I need help and willing to accept it when it comes. And that's why we're all here, right? That's why there's no, this world consists of more than one of us on it, right? Because we are here to share, right, love and joy and care, right, for each other. That's what it's all about. You can't experience giving if no one receives it, right? And it's awfully beautiful to give, right? That's a great feeling to experience. And you can't have the gift of that unless somebody, receives your gifts. So, wow, right? Oh, Tom, I swear, what a treasure to have gotten to know you throughout this whole experience of your recovery. I am so honored, and I know Paul is, and our whole staff, that we had the ability to be part of your recovery. Okay, just so we understand the flow of events for Tom and where his pain began. So he was doing great. He was getting ready to be discharged. And then after he had his physical therapy session before leaving the hospital, that's when the pain really started to get really, really aggressive for him, and it didn't subside. So, sometimes our bodies can react to things that sometimes, we're not prepared for that, right? We think we're going down a normal path, right? We're trying to fit into a mold that suits others very well, but for some particular reason, right, it doesn't quite suit us. And that's what Tom encountered, right, with his experience. So then he came home and he struggled for a few weeks until he got the X10, right? Then the gentle movement of the X10, day by day helped him progress out of that. And once he encountered his progression, he thought he was doing great. After about 5.5 weeks, now he's in outpatient physical therapy. And then doing therapy there, again, seems to give him another obstacle, right? So he regresses again into major pain issues, and now he has the X10 again, brought back to his home. So, sometimes, what works for one person doesn't work for another. So we need to keep that in mind, that we're all different, and we need to honor the way our bodies react to how we're treating our bodies, right? And some things can work for someone very well, but for others, that might be not the ticket for them. So that's what Tom experienced, and I'm so glad that he has shared his story with us, so that way, you do know that you have options out there, right? That, there's just not one recipe for all, right? You do have options, and you can take advantage of those and move forward the way it's best for you to move forward. And that's what Tom learned, and that's what he wanted to share with you. All right, thank you.
To learn more, visit x10therapy.com, 1-855-910-5633. Just a reminder, it's a huge help if you subscribe to, rate, and review our podcast. It helps people find us.
X10